Imagine you are walking into a high-end beauty salon. The air is thick with the scent of candles, soft music plays in the background, and you are sold on the promise of eternal beauty. You sit down in front of a luxurious wooden cabinet. No pain, no needles, no knives. Just a gentle wave of warmth washing over your face for exactly 4 minutes. You walk out feeling beautiful. But what you don't know is that at that exact moment, an invisible countdown clock has begun ticking inside your cells. The device that thousands of women trusted to make them perfect was actually a silent killing machine. It didn't kill them immediately. It waited 1 year, 10 years, 20 years. And when it finally returned, it didn't just take their beauty, it took their faces, quite literally. Welcome to the story of the Tricot system, one of the 20th century's most gruesome medical blunders, where the line between a miracle cure and lethal poison was thinner than a strand of hair. To understand how this tragedy unfolded, we must travel back to 1924. This was the era of the Roaring Twenties. Fashion was changing at breakneck speed. Skirts got shorter, sleeves vanished, and a new beauty standard was born. Skin had to be smooth and flawless. Body hair, once natural, suddenly became the enemy of the modern woman. The demand for depilation exploded, but methods at the time were primitive. Shaving made it grow back coarser. Plucking was agonizing. Women were desperate for a permanent solution. And as per the laws of the market, wherever there is demand, an inventor will appear. That man was Dr. Albert C. Geyser. He wasn't some street corner quack. Geyser was a reputable physician in New York and a professor of physiological therapy at the prestigious Fordham University. He had the knowledge, the status, and most importantly, he had a solution. By this time, X-rays had already been discovered, but the medical community was beginning to realize their danger: burns and necrosis from overexposure. But Geyser claimed he had solved this deadly equation. In 1924, Geyser unleashed the Tricot system onto the market. The heart of this machine was a device he called the Cornell tube. Geyser's argument was incredibly persuasive and sounded highly scientific at the time. He theorized that there were two types of X-rays, one that caused burns and one that was therapeutic. He claimed that the Cornell tube, made of special leaded glass, acted as a filter. It would block all the harmful rays, allowing only the safe therapeutic rays to pass through and destroy the hair follicle. It was a lie wrapped in a white lab coat. Geyser marketed it as a permanent and absolutely safe hair removal method. No painful electrolysis needles, no razors. Thousands of Tricot machines were leased to beauty salons across America and even abroad. And here is the crux of the tragedy. The people operating these radiation emitters were not radiologists. They were cosmetologists, young women with zero medical training who genuinely believed that the wooden cabinet in front of them was just a piece of advanced beauty equipment. Let's step into the shoes of a customer. Let's call her Anna. Anna walks into the salon, hoping to remove the fuzz on her upper lip and chin. She is led to a mahogany cabinet standing chest high. It looks more like expensive furniture than a medical device. The technician asks Anna to place her chin on a special rest to keep her head immobilized. Do not move. Directly facing her skin is the emitter of the Cornell tube. Will it hurt? Anna asks. Not at all. The technician smiles. You won't feel a thing. And that was true. The machine is switched on. The only thing Anna notices is a faint, low hum from inside the cabinet. Perhaps she feels a slight warmth, like morning sunlight hitting her skin. But there was something else, a distinct smell, the smell of ozone. In the closed room, the metallic tang of ozone filled the air as the X-rays ionized the surrounding atmosphere. To Anna and the technician, it was the smell of science, the scent of modernity. But in reality, it was the smell of radiation tearing apart the cellular structure of her face. The standard protocol was 4 minutes of direct exposure, no more, no less. But this wasn't a one-time fix. To ensure the hair follicles were permanently atrophied, Anna was told to come back again and again. Medical reports later, specifically research by Dr. Lapidus in the journal Surgical Oncology, indicated that victims often underwent anywhere from 15 to 20 treatments. Because the operators were beauticians, they had no dosimeters. They had no concept of cumulative dose. They didn't know that Dr. Geiser's Cornell tube didn't actually remove the danger. It simply lowered the intensity, preventing the skin from turning red and burning immediately. It tricked the body. It tricked the pain receptors. The ionizing radiation penetrated deep into the dermis, destroying the hair follicles, but simultaneously, silently shattering the DNA structure of healthy skin cells. Anna finishes her treatment. Her facial hair is gone. She is thrilled with her smooth skin. She recommends it to her friends, her sisters. The Tricho system becomes a money printing machine, but then the body's silence ends. The nightmare didn't begin the next day, but months, even years later. A slow-motion bomb had been detonated. First, Anna notices strange changes on her chin and upper lip. Tiny blood vessels begin to surface, weaving together like a bright red spider web. The once soft skin becomes thick and leathery, feeling waxy or like old parchment to the touch. She returns to the salon. The technicians are confused. They advise her to use more cream. But no cream can fix the breakage occurring inside the cell nucleus. Years pass. The irradiated skin begins to develop hyperkeratosis. Dry, scaly patches appear. Then come the ulcers. These aren't normal wounds. They don't heal. They weep fluid, ache with a dull throb, and expand. The face, Anna's pride, has now become a source of constant agony. But the worst is yet to come. Years after that beauty treatment, the tumors begin to form. Squamous cell carcinoma, basal cell carcinoma. They sprout exactly where Anna had rested her chin against the machine. The pain in the final stages was described as extreme. To save their lives, surgeons were forced to excise massive portions of the victims' faces. Many women had to have parts of their jawbones, lips, or cheekbones removed. From a desire to be beautiful, they ended their lives in isolation wards, their faces disfigured beyond recognition. This was the price of 4 minutes of warmth in front of the Tricho machine. This horrific truth could not be hidden forever. By the late 1920s, the number of women hospitalized with identical strange symptoms spiked. Dermatologists began connecting the data points. All of them had been treated at salons using the Tricho system. In 1926, the historic lawsuit Thomas v. Geiser erupted. Ida Thomas, a victim suffering severe facial damage, sued Dr. Geiser. She demanded over $100,000 in damages, a massive fortune at the time. This lawsuit tore down the velvet curtain hiding the machine's danger. In 1929, the American Medical Association officially condemned the device in their journal. They exposed the lie of the Cornell tube. There were no separate therapeutic rays. It was all deadly ionizing radiation. By 1930, the Tricho Sales Corporation collapsed under the weight of lawsuits and public outrage. The company dissolved, but its legacy remained. Thousands of women had been irradiated. These cancers didn't appear immediately. They incubated for decades. In retrospective studies, such as Lapidus's 1976 research, cases were recorded of women developing cancer 30 or 40 years after using the Tricho. Later, medical researchers sometimes referred to this phenomenon by a haunting name, North American Hiroshima Maiden Syndrome. The comparison is chilling. These American women carried radiation injuries similar to the victims of the atomic bomb, but they had paid money and voluntarily walked into the radiation zone. And what of the inventor? The fate of Dr. Albert Geiser is a twist of irony. Geiser, the man who constantly claimed his machine was perfectly safe, eventually paid the price with his own body. Due to excessive exposure to X-rays while testing and manufacturing the tubes, he developed severe radiation dermatitis. Geiser's left hand became necrotic. He was forced to have his fingers amputated. The hand that built the beauty machine was eventually eaten away by his own invention. Yet, until his company collapsed, he stubbornly defended his monstrous creation. The story of the Trico system isn't just a dark chapter in the history of cosmetics. It is a cold reminder of our blindness to the new. When science moves too fast for ethics and verification to keep up, human beings become the test subjects. Today, Trico machines sit in museums of questionable medical devices, silent and harmless. But in 1924, they were the pinnacle of technology. The next time you hear about a miraculous, permanent and risk-free beauty treatment, remember the low hum of the mahogany cabinet and the scent of ozone in the air. Because sometimes the price of beauty isn't calculated in dollars, but paid for with your life.